Hi, good evening everyone. I'm Dr. Siddharth, Junior Consultant Nephrologist from Citizens Hospital, Hyderabad. Today I have with me Dr. Seerapani Gopaluni, Senior Consultant Nephrologist, and my senior colleague from Citizens Hospital, Hyderabad. So today our purpose of seeing you all is to discuss about diabetic nephropathy, one of the very common, most common kidney diseases in the entire world. So through our discussion, we want to educate the general public what diabetic nephropathy is and what can be done to counter it.
Yeah, thank you, Siddharth, for the introduction. I think the purpose of this Facebook Live session is to educate the public through discussions between us two so that you can gain some important pointers. Please.
When it comes to nephrologists, diabetic nephropathy is one of the very common diseases they treat day in and day out. So the reason why we encounter so many diabetic nephropathy cases is because diabetes itself is so common in the world, and India is the diabetic capital of the world. So it's very unfortunate that India is the capital, diabetic capital. So because so many diabetes cases are there, India diabetic nephropathy also is very important to discuss, and is very important to educate the general public about it, because it's definitely a preventable disease. So today we are here to break some myths as well as know some facts about diabetic nephropathy, and I'm going to ask my senior colleague Dr. Seerapani some questions, and through this interactive session we are representing the general public. So hi sir, good evening.
Thank you.
Yeah. So what is diabetic nephropathy for the general public point of view? And one commonest question is, do all diabetics develop diabetic nephropathy?
Okay, as you rightly said, diabetes is very common. And if you look in our dialysis population, out of 100 patients on dialysis, 30 of them will have diabetic nephropathy. So it is a extremely common condition, and it is worth knowing what are the risk factors for someone to develop diabetic nephropathy. As you said, within India, let's say about 10% of the population may have diabetes, but not all of them will develop diabetic nephropathy. There are certain subgroup of patients amongst this that are likely to develop diabetic nephropathy. So let's try and understand what diabetic nephropathy as such is. I mean, nephropathy means disease of the kidney. So disease of the kidney due to diabetes, that is called diabetic nephropathy. So what actually happens? I mean, if someone were to have a uncontrolled diabetic status, okay, or very high sugar levels for a very prolonged period of time, that's when the chemicals, the glucose gets converted and gets sort of, it affects the small blood vessels that are present within the kidney. As a result of which, the filtering capacity of the kidney is impaired. So the ability for the kidneys to process the usual toxins, which is meant to sort of send it out in the urine, is disturbed. The first thing that we notice when someone has got a diabetic nephropathy is there may be a little bit of protein that is lost in the urine. And usually in the initial stages, this is not visible to the naked eye. And the only way of knowing it is by doing tests from time to time. So the main thing to understand is not everyone with diabetes will develop diabetic nephropathy. Diabetic patients with diabetic nephropathy are at high risk of developing a kidney disease that leads to a stage of dialysis. But there are a number of different things we could do from the onset where we have identified a patient to have diabetic nephropathy to the stage of where there is no other option other than going for a dialysis treatment or a transplant. There are a number of things that we can do, because this is, as you rightly said at the outset, this is a modifiable disease where if we take enough care, educate the public about what should be done in these situations, we may be able to halt or at least pause the disease progression such that they remain sort of dialysis free for a prolonged period of time. Having talked about what diabetic nephropathy involves, I just want to ask you a simple question. I mean, what are the early signs that a patient could look out for to understand that whether they have diabetic nephropathy or not?
Yes. So as you rightly said, as you rightly explained earlier, that how diabetes causes nephropathy is by impairing the filtering capacity of the kidney and thus causing protein loss in the urine. So causing protein loss in the urine leads to some amount of swelling in the legs and in the face. So this is one of the earliest symptoms of diabetic nephropathy. But by the time this has happened, you have lost so much time already. So the funda is not to come to that stage. We have to diagnose diabetic nephropathy much earlier than this. By the time you have got swelling in your legs in a diabetes patient, that means a significant amount of damage has happened. But that is the first symptom that a patient notices. Okay, so as earliest possible, as early as you get diagnosed with diabetes, so you consult a nephrologist to screen for diabetic nephropathy. So screening for diabetic nephropathy is of paramount importance, because once screened early, you can modify, as Dr. Seerapani rightly said, you can modify the course of the disease. But for that, you need to consult a nephrologist to see some parameters in the blood and in the urine, whether diabetic nephropathy has set in or not.
So what Siddharth you are saying is don't wait for the symptoms to come, because by the time the symptoms come, it's too late.
It's too late, and it might it is still modifiable, but some amount of damages are already happened.
So I mean, it doesn't mean that you come when the symptoms are there, but what we're trying to imply here is once you have diabetes, then it is mandatory that you have some routine checks from time to time to see what's your blood pressure doing, is there any protein in the urine, is your sugar under good control or not. Yes. So that's what...
So, and all the diabetic associations of the world, even the American Diabetic Association or the Indian Endocrinological Society, guidelines say that as soon as you get diagnosed with diabetes, immediately you should have a blood creatinine value and a urine protein estimation at the baseline, and you check that every year if without fail. And this is part of the screening protocol.
And this is more so important, especially if there is a family history of someone having kidney disease.
So if a patient comes to you with swelling of legs in a diabetes patient, so what test do you recommend to confirm the diagnosis of diabetic nephropathy?
Okay, that's an important question, because swelling of the legs, swelling of the face, loss of protein in the urine, a little bit of high blood pressure, these are very common to most of the patients with kidney disease. So these will per se, these symptoms per se will not tell us if someone has got diabetic nephropathy or not. There are certain clues that we may be able to get from the history by asking, I mean, have they got features of neuropathy? Neuropathy is a situation where the small nerves that supply the feet and the hands, they get affected. So they may develop pins and needles, tingling, numbness. I mean, this is not confirmatory for diabetic nephropathy, but it may give you some clues. Yes, this may be diabetic nephropathy. Another test that we commonly do in these situations is something called a retinal check, whereby we ask an ophthalmologist to give us some information. Has the retina, which is the layer at the back of the eye, is involved with diabetes. In such cases, the possibility of a patient having diabetic nephropathy is actually very high. So in which case, we may not have to do many other tests, and and if you have large clinical suspicion to exclude other conditions, then you may say this patient may have diabetic nephropathy. But a definite confirmatory test to establish a case of diabetic nephropathy is by doing a kidney biopsy. And this we may have to do it in certain situations. One, to prove that there is no other diagnosis other than diabetic nephropathy. So certain situations may be where there is a rapid loss of kidney function, where the creatinine continues to rise very rapidly. Or there are certain other unexplained symptoms that are not usually associated with diabetic nephropathy. So all in all, I think most of the times this is a clinical diagnosis based on the history, based on retinal screening, based on neuropathy features, and excluding symptoms that may be related to other diseases. And if these are not fitting with a diagnosis of diabetic nephropathy, then we sometimes do a biopsy of the kidney. And now that we sort of discussed about how to diagnose a patient with diabetic nephropathy, let's shift our focus to understand how not to reach the stage of diabetic nephropathy. So if I have a patient with diabetes, what are the things that I can modify or ask them to modify either in their lifestyle or things that may reduce the risk of them developing diabetic nephropathy?
Yeah, Dr. Seerapani. So now that we have spoken about prevention of diabetes and diabetic nephropathy, but still we see a lot of patients coming to us with the diagnosis of diabetic nephropathy. That means the preventive steps have failed. So they come with a creatinine of 2 or 3, and they come with a chronic kidney disease of stage 3 or stage 4. So is it end of the world? Are they dying? That's what they ask. So how do we manage a diabetic nephropathy once it reaches the nephrologist?
Okay, so, well, I think most of the patients, when they come to us in the clinic, they may have some symptoms like edema, like swelling of the legs, or they have already done some tests showing that they're losing a lot of protein in the urine, or their blood tests show the creatinine, which is a measure of the kidney function, is elevated. Okay, so what are the options that we have to manage these patients? Okay, one, even though we have missed the opportunity to prevent it from developing, I mean, it's still there are a lot of things that could be done to reduce the risk or the speed of progression. Okay, the first and foremost important thing is controlling your sugars. Okay, so we always advise to get a HbA1c, which is a measure of the last 3 months of blood sugar glucose levels, to at least less than 7. Okay, this, how do you achieve it? I mean, obviously with the help of an endocrinologist, you can adjust your medications to try and bring your sugars to as low, as normal as possible. Okay, that's the first thing. But there are certain other things you could do in terms of reducing the diabetes side of things. One is losing weight will definitely help you to get your sugars under control. The other thing is exercise on a regular basis would help you to, one, lose weight, and secondary benefit of that is you have your sugars under good control. Okay, and not eating junk food, because they are highly refined carbohydrates. They increase your sugar levels rather rapidly. So these are the things you could do from your side to reduce or get the diabetes under check. So that is the first element in terms of treating diabetic nephropathy. The second element, and another very important factor, is controlling your blood pressure. Okay, so controlling the blood pressure is multifactorial. I mean, it's not only the physician that helps you with the medicines, but there is also something that you can do from your side, which is, one, reducing your amount of salt that you take in the food. That is a foremost important aspect that will help to reduce and control your blood pressure, and as a consequence of which also improves your sort of outlook from having the diabetic nephropathy. And the other thing that you need to do is exercise. Losing weight will help you to reduce your blood pressure as well. So there is a lot of modifiable factors here. One is losing weight, getting your sugars under control, reducing the salt, keeping your blood pressure under check, which are in your hands to help yourselves. So this is what you can do from your side. There are other things as a nephrologist that we could offer the patients. Okay, these are mainly in terms of the medications. So one, we can adjust your medication such that your diabetes is taken care of. We adjust your medication such that your blood pressure is taken care of. There are a specialist subset of medications we could use in these patients to reduce, one, the blood pressure, two, to reduce the amount of protein that you're losing in the urine. So these are the things that we could do. And with the research that is going on in the background, every day we are learning a lot of newer things which are actually making a difference to the outlook from having this particular disease. So having said this, I just want to ask you, Siddharth, what are the new medications what are the medications as nephrologists that we could use and offer to the patients in terms of reducing the risk of progression?
Yeah. So blood pressure and proteinuria, the amount of protein in the urine, these are the two most important factors which contribute to the progression of kidney disease. Okay. So we need to counter these two, that is the blood pressure and the protein loss in the urine. So control the protein loss in the urine. So there are at least 5 to 6 class of drugs which do this. So the foremost, the most important and the class of drugs which have the most evidence for doing this is the ACARBs. That's what we call angiotensin converting inhibitors and angiotensin receptor blockers. So there are a class of drugs which help deal with your blood pressure control as well as decrease the protein loss in your urine. So by doing so, they retard the development of progression of kidney disease. So basically, they help you save your kidneys in simple terms. So now, so many new drugs have come out now, like SGLT2 inhibitors and
for example, dapagliflozin.
So these are a novel class of drugs which help you save your kidneys from in a diabetes patient. In fact, they have so many actions that they control your sugars, they control your blood pressure, they help you decrease your weight, They control your proteinuria. They're protective to your heart. So it's almost like a wonder drug, which is helping diabetic nephropathy patients a lot.
Yeah, yeah.
And one more new class of drugs is mineralocorticoid receptor antagonists.
Like Findenon, Carandia.
So a lot of research is going on, and so many drugs have come up in the last decade, which is helping save the kidneys in a diabetes patient.
Okay, so I think these medications are extremely helpful in controlling the progression of your kidney disease, but they come with a little bit of caution. Okay, it's just primarily because, for example, the ACE inhibitors that you mentioned, I mean, that can lead to a slight rise in the creatinine. And most people are really worried when we say there is a slight rise in the creatinine. But what we call this rise in creatinine is physiological, which means it is an expected rise because you're starting a particular drug. And this is completely reversible. And which means if I stop the drug next day, in 2-3 days, the creatinine will go back to normal. So this should not be a reason not to start a patient on ACE inhibitors. And most people, I sort of counsel them when I start these medications, saying that there will be a slight rise. Please don't worry. This is nothing in the long term. Is actually going to be beneficial rather than not. The other thing that we also see in this context is a slight rise in the potassium. So we always ask the patients to restrict their potassium intake. So these are simple things which can be adjusted and modified to help you get the maximum out of these drugs.
So finally, Dr. Seerapani, on behalf of Citizens Hospital Hyderabad Department of Nephrology, so the moral of this, the bottom line is that anyone who has got diabetes need not want to have diabetic nephropathy, correct? And with screening protocols, like after consulting a nephrologist, with screening protocols like blood creatinine and protein in the urine, we can control diabetic nephropathy. And and there are some modifiable risk factors which will help you not develop diabetic nephropathy. And even if you develop diabetic nephropathy and come to a nephrologist, there are definitely newer drugs available which can control and prevent the further progression of diabetic nephropathy.
Correct. So again, there are certain, sometimes the diabetic nephropathy, what we call as a progressive disease, which means despite our best efforts, the kidney disease may not halt and it will progress to a stage of needing dialysis or what we call as renal replacement therapy. But this is again not something that we need to worry so much about, because there are a lot of options even when you reach a stage of end-stage renal failure.
Disease, but the main purpose of this talk was to not reach there, and we are there to help you not reaching there. So anyone who has got diabetes, please consult your nephrologist and get your kidney screened and don't develop diabetic nephropathy.
Thank you.